Okay, I am going to do last talk. Yeah, my talk is actually the title of my talk is Initial Degradation Property of Two Fully Observable Polyaryl-lactide Co-galactic meshes. And actually, this is a collective effort from quite a few people, as you can see here. Yeah, as I said, I'm with the Johnson & Johnson Global Surgical Group. That's a new name for division. We all know PRL, PGA, and their copolymer represent the most widely used observable polymers for, to make surgical device implantations, sutures, observable pens, anchors. So for various applications, observable material are made into device. One of this device is surgical meshes. Before getting to this, what we did, I actually want to give some background on why we do this study and what we did before the study. As you can see, actually we published quite a few studies in biomaterials journals and also at private biomaterials meetings and also SAS meetings quite a few years ago. So that's why we continue to do research in this area. Yeah, all of us knows, and ideally we want to observe polymer implant should have a precisely controllable property and degradation rate which matches tissue healing rate. However, this is very hard to achieve in real case because human beings are individual. Like individual property, the changes, basically. If any medical device made from the biodegradable polymer, the logical study is to study their degradation property in terms strength retention, materials loss. Keep in mind the strength retention and absorption are two different concepts. The former happens far before the later. I think in last presentation or the presentation before, they said what kind of mesh is used depending on the application. It's a degradable mesh, or non-degradable mesh, or partially degradable mesh. All depends on what you want and what you want. Probably in most of the cases, in some cases, you want a degradable mesh because an implant, no matter what, is a foreign body when implanted into a human being. So you want basically optimal outcome is you want the lateral tissue to replace the implants eventually. So the objective of study is to investigate in vitro degradation behavior of two observable meshes based on PRGA. We studied a property shown here. For the mesh characterization, what tests we should done, like the tail strand, suture pull out, the kind of stuff. There is a FDA guide you can get from FDA website what you need. Basically, the general properties, those sum of the property we may need to correct the mesh properties. So this slide shows the initial property for the mesh we used in this study. One has large pores, however, it has higher density because mesh property not just depends on the density, also depends on its construction. basically knitting structure or woven structure, those kind of things. You can see one mesh is stronger than other. Previous talks discuss a lot about the tensile strength. However, one of the important properties for mesh, as we can understand, is the burst strength. Basically, there is a burst pressure acting on the mesh when you implant it in the human body. So there are several burst tests you can use to determine this property. Merlin burst test or ball burst test. They all have the corresponding STM standard. Yeah, the slide shows the two mesh we used in the study, how they look structurally speaking. One has very large pores but less pore numbers. Another has a lot of pores but pore size is smaller. So one important thing is because in all of our study, it is very important to describe how the study is conducted, how your method, because you want people to repeat your study, you have to give the condition you yield to correct your materials. For example, strength, if you give the 10 Newton, 5 Newton, if you don't be careful, mesh strength very much depends on the weight of your sample you use. So if you just give the Newton, that's probably hard for people to know how you get that. So those basically, this slide lists the testing condition we used in this study. Okay. Yeah, these two plots shows the strength comparison for two mesh. Basically, for tensile strength, we normalize by the sample weights. I also want to point out the test we use a little bit different from STM standard. The reason for that because STM standard calls for a quite large specimen size. Because for many studies, we want to put those material into animals. So there is a restriction on the sample size we can implant into the animal. However, this test, we showed this test repeatability is quite good. As you can see, the error bar is small. Yeah, we presented strength decrease as a breaking strength retention versus in vitro time. And there are two tests, as you can see here, burst and tensile. And basically, if you normalize your tensile strength by your initial strength, percentage of your strength retention follow in the same kind of trend. Essentially, they are the same in this case. The reason for that is because for those materials, their degradation is hydrolysis dominated. You are not expecting other enzymatic accelerated degradation. There is no such thing. Yeah, we also measure the molecular weight drop of this material as a function of time, as you can see here. So a few years ago, we published a paper in Biomaterials Journal. We actually found the simple relation between breaking strength, retention, and molecular weight. So we want to see if the mesh also follows this equation. Actually, this equation, we are the first to propose this equation. Actually, the two mesh does fit this question no matter its tensile strength or burst strength. Lastly, and if you going from mesh strength 100% to all the way to 0%, you see there is a critical molecular weight. Below this molecular weight, there is a low strength for the mesh. Yeah, this slide shows basically optical microscopy of the mesh. I mean the light mesh. Basically, it's hard to see any change after 4 weeks. The reason we took just up to the 4 weeks because the main thing in the study, we studied mechanical property change. You see some fiber breakage, but very few. Yeah, we also sent the sample for SEM, the similar result as the optical microscopy results. In conclusion, we studied the in-vitro degradation 2 observable meshes, and the tensor and burst strength and the molecular weight of mesh decreased significantly over time. And we don't see the much change in mesh morphology, no matter we use the optical microscopy or SEM. There is a close relation between the strength retention and molecular weight. And possibly, mesh knitting structure has low effect on the material's percentage of tensile strength retention profile. Yeah, I want to thank those people for the review of abstract, which we sent to biomaterials meeting a few months ago. Thank you very much. I would like to take questions.
Just a quick question. Thank you very much. So with your degradation, the strength decreased pretty quick. I was wondering if you had any expectations for how long you would need a fairly high strength before it started to go away during the healing process.
Oh, this actually is hard to see how long you need for the tissue healing. Like we talked to a lot of surgeon doctors, because nobody knows this. Somebody say 4 weeks, another one say 8 weeks. There's no definition. Also, like I said, there are individual different human beings. So it's hard. I mean, for this mesh, it is true the strength retention will be 4 weeks. And
Dr. Deng, thank you. I may have missed this, but I wasn't clear on the environment, in vitro environment that you exposed your meshes to so as to see this rate of degradation. Was it buffered saline, or what pH was you controlling at? I wasn't sure. Was it at room temperature, at body temperature? Could you just share a little bit about how you did that experiment?
Yeah, thank you. Actually, this is in one of the slides. This is standard in vitro condition. We do those kind of study. pH, we use 7.3, and the temperature is 37 degrees C, buffer solution, and we change the buffer every few days. Although hardly you will see any change in the buffers, in the pH of buffer solution, because you always got much more buffer than the possible acid will generated, may be generated.
I want to again thank you for a very nice presentation as the Indian president of the Society for Biomaterial, and this is the last presentation of the last day. I want to, thank everybody who's here, stayed through, and I was most impressed. There was always questions for everybody. It was a very good session, and thank you guys for coming, and I hope to see everybody in 2013. And let's give a round of applause for yourselves and for our speakers. Thank you, and have safe travels home.
Yeah, thank you. See you next year.